Hi, everyone. Welcome back to the Integrative Health Podcast with Dr. Jen. Today, I have two beautiful women to talk to us. Dr. Stein is a clinical director at the Healing Depression Project. She's a leading expert in the functional medical psychiatry and a best-selling author with 30 years of experience helping people recover from depression. She's a board-certified psychiatrist, a distinguished fellow of the American Psychiatric Association, a certified practitioner of the Institute of Functional Medicine, a former clinical assistant professor of psychiatry and human behavior at the Warren Alpert Medical School of Brown University, and was awarded the Exemplary Psychiatrist Award by NAMI-RI in 2008. She also has an international best-selling book on Amazon, It Is Not Depression, Your Guide to Finding Answers, that offers great groundbreaking functional medicine perspectives. So Dr. Stein works with our other woman who is here, Silvia Covelli, and they both are going to tell us about this 45-day depression recovery program offered by Healing Depression. Silvia is the visionary founder of the Healing Depression Project. She's an honors graduate from Boston's College and a former social science researcher at Harvard University. She pursued graduate studies in finance and business law and dedicated her career to entrepreneurship, becoming a skilled business strategist. In her parallel with her thriving career, Silvia faced relentless and chronic depression, exploring over 60 different treatments without finding sustained relief. And her personal struggle, combined with her extensive background in human transformation and mind-body connection, led her to develop a program that has remarkably eradicated 25 years of depressive symptoms, leaving her depression-free ever since. Welcome, Dr. Stein. Welcome, Silvia. So glad to have you guys here.
Oh, thank you for having us, Dr. Jen.
Yes, of course. So I think to start this out, I really want to hear from Silvia about this depression, this chronic depression, and like what was the turning point for you?
Well, Jen, I struggled with depression for over 25 years. It started when I was 18, and regardless, despite of everything I tried, different treatments, different approaches, different programs, like nothing ever gave me sustained relief. Some of the programs work in a way, I would say, I would get like a temporary relief of the symptoms, but eventually they will always ended up coming back. So it was always on and off, this endless cycle, and the symptoms, again, were always there. So, I mean, after 25 years of trying different things, it's not like you have a lot of hope, honestly, because you've been let down by so many people. I reach out to as many doctors as we can count, and as many psychiatrists, and I did follow tons of advice, but still, the condition was there. So at that point, what was really like the turning point for me was, there was like one thing was I started questioning the integration, meaning what was I doing on my daily life? What were those daily habits that I was having? If, for example, I knew for that meditation was something that was, helping me, that was something good. So I started questioning if I was doing that on my daily basis. And I went, the same road with, with all the other things such as exercise and such as nutrition. So that was a big turning point when I saw that unless I integrated the things that I knew were good for me, and then, I was not going to find, lasting relief from this condition. But then there is a huge paradox, like how do you go about creating that change in your life when precisely when you are going through depression, some of the symptoms of depression are the things that you really need in order to change. For example, if you're going to exercise or if you're going to go out for a walk, one of the things that you need clearly is energy. And, on depression, one of the main symptoms of depression is this extreme fatigue, and your body is completely energy drained. And then another thing that you need in order to implement any change in your life is motivation. right? And then motivation is another thing for depression that is, in a lot of cases, just completely lacking. So it was this thing of like, I needed to, the need to change, but this, huge struggle that I was going through. And this is the beauty of a residential program, because at that point, what I did is, I stopped completely everything. So it was the equivalent of like retreating myself. I stopped working. I realized that, when depression becomes chronic, or like, or what psychiatrists call treatment resistant, it's not really a matter of 2-3 hours a week, but the way I felt is that it needed to be like my full-time job, and that all my concentration and my energy should go into healing. And that's the power of this, program that we're creating, where you can actually say like, wait, I've been, concentrating on other people. So I've been concentrating on my career, like it was my case, or, or I've been, thinking for years that I can get over this just by doing A, B, and C, but taking like an honest look at the situation. This is overpowering, and it's taking over my life. So at that point, when I really like stop everything and just concentrated on doing this healing process, that was really a huge turning point, together with the fact of taking a look at the root causes, because there's this, I would call it misinformation, that a lot of psychiatrists, they, especially in conventional psychiatry, they think that depression is only in your head, and they don't look at other factors that are really, contributing, or in some cases actually generating these depression symptoms. And that was really big for me, just moving beyond the idea that depression is only in my mind, and looking at my whole body, running tests, seeing what was, any dysfunctions, any imbalances, any, deficiencies that were in my body, and addressing them. So it's actually, that was a huge turning point, healing the body first, and then that gave me the strength to also move to other pieces, to like trauma that is still needed to be elaborated, the mental setting, like so many other things that you need to work in order to truly overcome depression.
Mm-hmm. Yes, thank you for sharing that, because I know it's not easy to talk about either. It has this stigmatism, and depression and anxiety in my office, my functional integrative office, I tell patients, this is a symptom. I don't think it's a disease. I think it's a symptom for something else going on. Like, no one wakes up and chooses to be depressed or anxious. So we have to kind of peel back the onion layer. And yeah, like you said, nothing was helping. You were probably, on medications and supplements, and sometimes it's not that. You have to dig deeper and keep going, and just keep going and turning over those stones. So I would like to ask Dr. Stein, can you tell everyone listening, what's the difference of functional psychiatry versus just psychiatry? And honestly, there's not a lot of functional psychiatrists out there. So I love that you do this.
Yeah, well, the topic is mental health within psychiatry, and functional psychiatry is basically the functional medicine approach to mental health. And it's looking at root causes of depression, as opposed to assuming that it's all in your head, that it's all psychological or psychosocial, so to speak. There is a biological component that's well known within psychiatry, but there's not a lot of emphasis on the biology of mental health issues, other than very few disorders like hypothyroidism or B12 deficiency or folate deficiency. It's very, very narrow. And what functional medicine does is it looks at other root causes that cause physiological changes in the body, resulting in inflammation that ultimately affect the brain. And the brain is also, it's the software as well as the hardware. And so you might have a history of having a psychosocial problem that it could be exacerbated by the fact that you don't feel well physically. And so you're not able to have the ability to work through those issues. You'll have a shorter temper maybe because you don't feel well. And I know that you understand that because you talk about the invisible illnesses that people don't understand. How is it that you can be sick? You don't look sick, right? But there's a lot of people who don't feel well, and those illnesses or syndromes, I should say, affect your brain because of an inflammatory process. And so that's almost ignored. It's acknowledged like that it's there, but they don't necessarily connect the dots that it is part of the problem that's resulting in depression and anxiety and psychosis and ADD and cognitive impairment. It's not just depression. But what we do as functional medicine doctors is connect the dots, and we actually address those issues. What is causing all of the problems that has a root cause? And so I use the analogy of the electricity within your neighborhood going out, right? It's not that the bulb doesn't work. You could keep changing the bulb, because the lamp went off. Like we keep changing the antidepressants, right? I call it the medication merry-go-round. We keep changing the antidepressants, just like we keep changing the light bulb. Like maybe the light switch is off. Maybe the lamp is not plugged in. Maybe the whole electrical grid is out in your neighborhood or your town or, the whole region. You don't know what's happened unless you investigate and connect the dots. So that's my answer to that question, that wonderful question. I think you're the first person who's actually asked me that question.
Well, I love the light bulb analogy because I'm sure a lot of patients feel like that. They're like, they come to me a lot of the times to wean off all their antipsychotic drugs or their antidepressants. And we do that slowly while we're fixing gut health, while we're, seeing the root cause. So
Right.
to talk about root causes, what are some of the common root causes of depression?
Well, I use the word shift because the shift in mental health to remember the 5 root causes that I look at. So, and I usually start with food. So food is definitely medicine, but food can also be poison for some people. And it's a matter of finding the right food plan for the person. So food, chronic infections, there's a lot of research coming out now about how chronic infections can cause not just increased gut permeability, but also causing immune dysregulation. We know a lot about that because of a certain virus in the air, but it's not just gut pathogens and viruses. There's parasites, there's all sorts of pathogens that can affect your body that can also affect your brain. And also physiological functions that prevent you from getting, let's say, protein broken down into amino acids that are ultimately put together as neurotransmitters that in your gut that your brain needs. So H. pylori is what I'm talking about. So food, infections, toxins. One toxin, I know you talk a lot about toxins. One toxin that people overlook or don't really understand how much depression, I see it over and over again, depression and anxiety is from mold toxicity. People don't realize how moldy their homes are and how much mold can cause severe depression and brain fog, cognitive impairment, dementia. And stress. Stress. I call my patients that are the Energizer bunnies, that they get really angry at their bodies for not keeping up with their brains, and so it's the stress impact of increasing cortisol, which is hormone. So that's the fifth letter of shift, scrambled. So stress, hormones, infections, foods, and toxins, are the 5 pillars that I start with and do a deeper dive, breaking that apart in different variables as well. So hormones being adrenals, and which then also can affect your sex hormones. But that's it in a nutshell. There's a lot more details added to that, which is laid out in my book, What If It's Not Depression?
I love that. It's so important. And it's important for patients to be heard when they're told they're depressed. A lot of them go to their primary care doctor, or they get referred from their primary care doctor to just a regular psychiatrist. And it's just they're written a script and told to go talk to someone. And then they feel crazy. They tell me, they're like, I felt crazy that no one was listening to me. They feel gaslighted. I mean, it's all this
Right.
awful stuff. And I think it's good for them to hear this information you guys are putting out, that there are root causes, that it can be healed, but it is hard. So Silvia, can you talk about what you went through? Because you said, so you were just this like businesswoman, entrepreneur, and going through things kind of like Dr. Stein was talking about, the Energizer Bunny. And what kind of treatments were you offered? And like, how did you work through that mentally? Like being an intelligent woman, like knowing like this is not working.
It was very difficult. One of the most difficult things is I love it now. Just before when you were talking, when Dr. Stein mentioned like and that you talk about too about these illnesses or conditions that are silent, because no one really sees this. And just when I started talking about this topic, because the program that I created was actually just for myself. At that point, the only thing I wanted was just to feel better. And I was very surprised and incredibly happy to see that it worked. And that's how it was for a few years until I felt the calling of sharing this with other people. But at that point, it was only survival mode. What I wanted to say is that when I started talking about, what I went through in order to create this program, when I first talk about this with, for example, with my business partners, one of them was like, what? No way. Like, how? When? Like, he was like, where was I? What did I miss? Like, and I was like, well, all the time. And he's like, so that surprise is that you can be still, there's different types of depression. In my case, I was very functional and I was able to go to all the meetings, do all the work. But that doesn't mean that you are at a point of health. That doesn't mean that, that you're not going through, all these like emotions and thoughts and really an extreme fatigue. I would say that was one of the main symptoms that I was feeling. So it was very hard also, like what you were asking me about the doctors, because I knew, I had like study enough or just like maybe just some, logic that I knew that there was something else going on. And I kept saying to my psychiatrist, let's run more tests like this. Let's check, I will read about things. So like, let's check about this. And then the answer was always the same. It's like, no, it is depression. And I'm like, oh my God. So actually, when I heard the name of the book of Dr. Stein, What If It Is Not Depression? I love it because I'm like, I guess that's, that was what I was trying to say all the time to the doctors. Is like, but what about if there's something else? No, it is depression. And I'm like, oh my God. So just, it's extremely frustrating. So I can only imagine what people are going through. And then when you go and just look for something different, the most that you get is that they change your medication. Medication in so many cases, it doesn't work. I mean, it is life-saving in a small percentage. That's a fact. But other than that, in the large scale, like we need to look at what's going on with the treatments, because now, like, and the people that I talk to all the time, that they call, that they reach out for help, is people not with like 6 months of depression. They're calling with like 10 years, 20 years, 40 years, a lifetime of depression. So depression became this thing of like, it's very chronic. It is, labeled as treatment resistant, recurrent, and I guess that what that really means is that they're not like effective treatments, because if they were, then the story would be different. I would be here saying like, I had 6 months of depression and I recovered. But no, now you're hearing these stories that are heartbreaking, because it's a whole life. It's your entire life. It's well, in my story, doctors, they don't really listen to you. So functional medicine is a blessing in that sense, because it's you doctors like really like sit down with the patient and do just the intake that is like 1 hour, or sometimes even like way longer than that. Just that, and being able to tell you, oh, there you go,
2 hours.
Love it.
being able to tell the story and just being able to, that you feel validated and that they really look at the whole picture. Just in our program, before the person arrives to the program, we're running blood, urine, stool tests, like to get, so by the time that they arrive, Dr. Stein already have those results and she's ready to start working with that. But that's the validation of like, let's check what else is going on, and let's not only check, let's find it, let's address it. So yeah, it was, to answer your question, just very frustrating, and they just don't listen to you. That was at least my my experience with conventional psychiatry, and they try to fix it with medication, and medication is not working.
Right. That's a great point about the medication. I feel like it's just a Band-Aid most of the time. And I have not had a patient that has come into my office that feels amazing on their medications, right? They still have that depression. They still have that syndrome or that symptom. And working in the ER too, we get a lot of psychiatric patients in the emergency room, like a lot, right? So
Yeah.
I've seen a lot over my lifetime of working in the emergency room in my training, and they're on all these meds too. And they're still having these suicidal ideations, hearing voice, they're still having this stuff. And now that I, have been practicing integrative medicine and did my fellowship, when I work in the ER still, my heart kind of breaks. Like sometimes if they're with it enough, I talk to them a little bit about nutrition or, other maybe root causes where they're living and all of that. But it's a really broken system, unfortunately. And people
How
don't.
much can you do in that time, right?
Yes. Yes. And the patients are kind of told like, oh, you need to be on this medication. It will fix everything. Then it doesn't fix it. And then some of them are really hard to come off of. So I feel like the patients are kind of caught in, are they given true informed consent? I don't know, because I don't think people with depression are told that they could heal it, or they're told they could fix it with a drug, but they're not told they can heal it. So Dr. Stein, I mean, what have you seen with regards to like medication and getting patients off, and in the healing project in those 30 days, are you going to be weaning patients off of their antipsychotics, antidepressives?
Well, the first thing is do no harm. We want to make sure that they're on medications for the right reasons. My practice is such that people find me and, because they look at holistic or integrative or functional care as being almost sometimes anti-medication. That is not the truth. I'm a conventional doctor as well. I don't prescribe medications as much because of what I do and why people see me. But there is a place for medication, absolutely. And so I make sure and evaluate that the medication is something that they could potentially take, or I've even told some patients, few, but that, you really need to stay on this medication, but I'll explain to them why. It's important to really explain why, because it would be worse for them if they were to taper and stop the medications. And usually people are able to, accept that and understand it, and then at least feel comfortable, like, okay, the benefits outweigh the risks, and these are the reasons why. So it's always a benefit risk ratio. So I would imagine that during this retreat that we would not necessarily be changing medication. Even my own practice, it takes time. The thing about functional medicine is it takes time, it's work, and it is changing a lot of things over anywhere from, 2 to 6 months in order to address the root causes and have someone feeling a lot better. And so I wouldn't necessarily make a change in the medications unless they were having severe side effects until after those 6 months. So if they're stable on medications, they're not having side effects, it's better to wait until they actually feel a lot better for 2 reasons. One is that usually these people have tried to taper themselves off and had a really hard problem, and then the depression returns. So then they lose confidence. Is like, is this depression or is this withdrawal? And they don't know. And so they're a little scared, even though cognitively they might, I want to be off this medicine, but emotionally there's like, am I going to have this withdrawal? Am I going to have a problem? Is the depression going to come back? So it's better to actually make the depression go away with the healing process of doing functional medicine. And then they'll see, oh, the medicine hasn't changed, but I got better by doing exercise, by changing my diet plan, by doing breath work and meditation. Like, I did all of these things, and that's what helped the depression to go away and the anxiety to go away, or whatever symptoms that they're experiencing. And you feel more empowered and have confidence that, hey, it's not the medicine that's making me feel better. It's all these things that I put into place. And the other reason is that once you've made those changes, it's actually easier to come off the medication. You're less likely to have withdrawal symptoms because you're starting to make your own serotonin. And so that's why it's so hard to come off of these antidepressants, is because you're not making the neurotransmitters. I use the analogy of pulling that Band-Aid off. If you have, sometimes it's easy to pull a Band-Aid off of your arm, but if you don't have hair, but let's say your skin is really sensitive, let's say it's burned and it's really sensitive, and you have a very hairy arm, you know how much pain it would be to pull that Band-Aid off. So it's like these receptors hold on to the antidepressant, and it literally hurts to pull it away. And so if we can replace it with your own neurotransmitters by all the work that you've done, and start making the neurotransmitters in your gut that your brain needs, then you're less likely to have those withdrawal symptoms. So those are the 2 reasons why I would wait. It's confidence, and as well, it's just easier to come off of them.
Yes, absolutely. And you bring up a great point, how people have tried to get off of them by themselves, because usually they do, because it's like they realize it's not helping, or they just they just keep increasing it, and I'm not getting any benefits, and I'm just getting more side effects. So yeah, I love that.
Now, there's certain strategies that you want to follow, to make sure that you come off of them smoothly, and to be careful about how to be careful. Yeah.
Yes. Don't do it by yourself. I mean, I write out a program like after I've worked with the patient for a few months, and I'm like, okay, I think we're ready. Your gut health is good. But, I mean, this is like really little bit at a time. And it's like usually a 6 to 8 week time, sometimes longer. It just takes a long time, and you have to give yourself that grace. Now, during the Healing Depression Project, I don't think we filled everyone in. So it's a 30-day in-person retreat, and then it's 15-day intensive when you get home. So during this 30-day in person, I know, Silvia, you alluded to, they're already going to have their testing done, stool, blood, urine. So when they get there, what happens to uncover these root causes?
Okay, so the program has a 360 whole person approach, and everything gets addressed, because with depression, it gets into every dimension of the being. It's not maybe in another, if you're experiencing a different condition, maybe, maybe it's just your body that is feeling A, B, or C. But with depression, like what we see and what I was going through too, is that it's everywhere in your being. So it's in the body, it's in your mind, it's in your emotions, even in your spirit, you know, like how connected are you feeling? You know, do you feel that there's a sense of purpose? Like even to that degree, this condition like affects everything. So we start with the body, and with the body is all like the functional medicine piece, and you know, everything that Dr. Stein was explaining. So we try to get the person to start feeling better, more energetic. We also do a lot of work in the restoration of the sleep cycle. And of course, like another big piece that we do is food. So specifically metabolic psychiatry, which has been showing in the last 20, even 30 years, amazing research for chronic mental health conditions. And this is super important. For me, nutrition was a key piece in this puzzle. And it's just really, it's not only like, what are you, it's what are you eating, and what is, how the ability of the body to process that food. Is the body, you know, metabolizing that food in the way that is, you know, the way that the body needs it, and what is the health of your brain based on all that. So nutrition, we have we're working with a nutritionist specialized in metabolic psychiatry, and also doctors that do that piece too. So during the whole program, they have a specialized diet and nutritional interventions grounded on metabolic psychiatry. And we also do for, we address trauma in a beautiful way. Is our therapist works in group therapy for especially experiential therapy, which is been shown very effective with depression, versus talk therapy that sometimes you're like years and years and years on it. And while it brings you understanding, because maybe you get to a point of like, okay, now I understand, you know, A, B, or C, but it's now what do you do with that? Which was, you know, I went through that too. So the understanding didn't bring healing. It's just, it brought, in some cases, actually brought even more concerns, or, you know, because you go so deep into it. But then this kind of like therapy is really going into like overcoming that and really working on that trauma. And we do that together with somatic therapy. And because, you know, trauma is also stored in your body in so many ways, even childhood trauma, or, you know, so actually all sort of trauma is stored in your body. And somatic therapy, like through movement, and it helps just really get that completely, well, as much as possible out of your body, and it allows the person to work through it in a more effective way. So for the mental piece, we also do meditations, special meditations that lower your brain waves, and that actually allows to access your subconscious mind, so that you can restore all those limiting beliefs that we all have, especially if you've been dealing with depression for a long time. And you have gone through, like, you know, one treatment after another. It gets to a point where you don't really believe that you're going to get better. You want to get better, but deep inside you kind of know, like, oh, this is just going to be another treatment. This is just going to be another program. So it's to bring back that hope and that belief, you know, in yourself, and bring in just even the idea sometimes that healing is possible. That's a huge breakthrough. And that is actually the first piece, you know, something that we really concentrate on, like giving this idea of, yes, healing from depression, it is possible. It is not this like condition for life. So we address like all the areas, and then we mix all that with everything is taught as a training. And it is in that way, because if you cannot replicate the program at home, if you cannot implement these things at home, then I think the program is not going to be successful. I went through like some of these programs that were not bad in themselves, but then when I would get back home, what do? you know, you don't have the structure that you used to have there. You're completely on your own. Then your old self tends to come back because you return to your old environment. So all these triggers and everything starts. So the way that we teach it is in a training to help you, like, not only during the program is a lifestyle transformation habits taught with the science of habits formation, because there's a science behind that. There's a science of like what makes it easier to actually start a habit and stick to that habit versus how can you make it, like, you know, easier versus, you know, you can just maybe it would be like really difficult sometimes to change. So we make it easy for the person to start to building these habits, and then that's during the 30 days of the program. So that is the lifestyle habit, is the lifestyle medicine piece of the program. So we do the 3 medicines: is functional medicine, metabolic psychiatry, and lifestyle medicine. And then those are the 30 days. The program lasts 45 days because then they go back home to their environment. And then we're there with them every day for 15 days, helping them in the integration. So and specifically for your life, depending on who do you live with, what are your obligations, what is your schedule in your real life, because then, yeah, you retreat yourself for 30 days in order to concentrate into healing. But eventually you have to come back, and eventually life cannot be that, you know, heaven that we're gonna make for you. You have to like come back to, you know, to your day-to-day life. And so we help you in integrating this in order for the person to really be successful and to maintain these practices of well-being that will be what will in the long term, this is what's going to bring, you know, complete relief from the condition. In my case, even up until today, I still do like the things that I started doing 5 years ago. So it's something that this is the beginning and a reset of the possibility of a complete new life. But then when you go back home, you need to continue with, you know, with the nutrition, with the exercise, with the meditation, with so many things that, and, you know, continue with the treatment. So in order for you to find, you know, real relief.
Yeah, I love that. And I love, well, 30 days is important when it comes to habits. So you did that on purpose, it seems.
Yeah.
And you mentioned food. So what is the role of food in depression? And I know that's going to be an important part of the Healing Depression Project. If Dr. Stein wants to answer that.
Oh, well, the diet that has a lot of research backing it up is the ketogenic diet. There's a certain person that we're using in our program and her protocols. Her name is Patricia Daly. I don't know if Silvia wants to say more about that, but for a long time, there has been research that showed that the ketogenic diet has been helpful for seizure disorders, and Kat Toops has demonstrated, she's a functional psychiatrist on the West Coast, and she's our research director, and has demonstrated that this diet is really helpful for her dementia population. So that's the diet that we'll be utilizing, and at least that's the target diet that we'll be presenting for the people who are in the program. I'll let Silvia talk more about the person who is going to be working with them on this diet.
Yeah, so it's Patricia Daly. She has a master's in nutrition, and she specializes in ketogenic diet. She's a best-selling author of the Ketogenic Kitchen, and she's been working for many years treating chronic conditions. She's done a lot of work with cancer patients, and also in mental health chronic conditions. So she's designing a special diet for, you know, for the, you know, for the whole 30 days. And this is based and actually inspired in many ways by the work of Dr. Chris Palmer. if if the listeners are familiar with him. So that's been his life work. He's been doing this, if I'm, I believe for 30 years, conducting amazing research, showing great results, even in conditions in psychiatry that were thought not to, to have any solution, such as schizophrenia, for example. That's one of the main mental health conditions that this diet has shown extremely promising results. And it's really encouraging just to have those results out there. And I experience it myself, that's the reason why I'm so like into this nutrition piece. In my case, what I felt that did the most is when I started doing intermediate fasting, but those intermediate fasting in a prolonged like fasting. I'm not recommending this. You have to, really talk to your doctor about it. But this is what I did in my case, and just implementing a keto breakfast and just adding all those fats that were lacking. And that created such a big difference. And if you think about it, the fasting, what a keto diet does is it mimics a state of fasting. So I was mixing the two of them, which really helped my cells and my entire body to change the way I was, the body was processing the food and the metabolism of it. So my energy levels, I think that's the main thing that that changed for me. The energy levels were completely different, and that gave me the strength to also do the rest of the work and the rest of the changes, because it doesn't matter, all the other things that you have to do. If you wake up in the morning and even taking a shower seems like a struggle, then how are you going to implement the rest of the work? How are you going to really make this big change in your life? So that was one of the key pieces for me. And this is, research is showing that is a great component. And the relationship between food and depression is really to the point that I love it when they say, are you feeding your depression? Because that's what it is. Like, can you, because food can help you heal, but also is, a lot of people with depression and a lot of people that I talk to, what they tell me is it's like that they are eating a lot of sugars and a lot of carbs, and that's only, just making the situation worse. And then you don't know, what's bringing what, but for sure it's a cycle that is, it is feeding your depression. And that's something that needs to change. And again, nutrition is one of the most difficult things to change. Yeah. So the way we do it is that in the program, you will get the food, but then we're also going to teach